Question 1. A healthcare organization is experiencing an unexpected increase in patient falls on a specific unit, exceeding its established benchmark. Which of the following is the most appropriate initial step for the quality improvement team to take? A. Immediately implement a new fall prevention protocol based on best practices from another facility. B. Conduct a comprehensive root cause analysis, RCA, to identify the underlying factors contributing to the increase. C. Retrain all nursing staff on existing fall prevention policies and procedures. D. Benchmark the fall rates against national averages to determine if the issue is widespread. Answer: B. Conduct a comprehensive root cause analysis, RCA, to identify the underlying factors contributing to the increase. This question tests your understanding of the initial steps in a quality improvement process, specifically when dealing with a significant, unexpected deviation from a benchmark, indicated by the keyword most appropriate initial step. While retraining or benchmarking might be part of a solution, a root cause analysis, RCA, is the essential first step to deeply understand why the problem is occurring by identifying its fundamental causes, rather than just treating symptoms or implementing unverified solutions. For example, without an RCA, implementing a new protocol might not address a staffing issue or equipment malfunction that is actually causing the falls. Always aim to understand the why before deciding on the what to change. It ensures your efforts are targeted and effective. Question 2. Which of the following best describes the primary purpose of benchmarking in healthcare quality? A. To identify and punish underperforming departments or individuals within an organization. B. To compare an organization's performance with that of leading organizations or established standards to identify opportunities for improvement. C. To ensure compliance with external regulatory requirements and avoid penalties. D. To set internal performance goals based solely on historical data trends within the organization. Answer: B. To compare an organization's performance with that of leading organizations or established standards to identify opportunities for improvement. This question focuses on the core concept of benchmarking in healthcare, and the phrase primary purpose is a key clue to distinguish it from other quality activities. Benchmarking is a strategic process where an organization measures its processes and performance against the best in class, whether internal or external, to learn from others and discover new ways to improve its own operations and outcomes. For instance, a hospital might benchmark its surgical site infection rates against nationally recognized top performers to understand their practices and adopt successful strategies. Remember, benchmarking is about learning and improving, not just about meeting regulations or solely relying on internal data. Question 3. A hospital recently implemented a new electronic health record, EHR, system. The quality department wants to assess the system's impact on medication error rates. Which type of data collection method would be most appropriate for systematically tracking and analyzing medication error occurrences over time? A. Patient satisfaction surveys. B. Focus group discussions with nurses. C. Concurrent chart review. D. Staff incident reporting system. Answer: D. Staff incident reporting system. This question assesses knowledge of appropriate data collection methods for tracking specific adverse events over time, with systematically tracking and analyzing medication error occurrences as the core focus. While concurrent chart review can identify errors, a staff incident reporting system is designed precisely for capturing, documenting, and analyzing adverse events like medication errors as they happen or are discovered, providing a continuous stream of data for quality improvement. For example, when a nurse identifies a near-miss medication error due to a new EHR alert, they would report it through this system, allowing the quality team to aggregate and analyze these reports. Think of it as the formal mechanism for frontline staff to alert the organization to safety issues consistently. Question 4. When prioritizing quality improvement projects, which of the following criteria should be given the most weight by a quality committee? A. Ease of implementation and low cost. B. Potential for positive impact on patient safety and clinical outcomes. C. Departmental interest and willingness to participate. D. Alignment with current staff skill sets and expertise. Answer B. Potential for positive impact on patient safety and clinical outcomes. This question highlights the critical factors in project prioritization within healthcare quality, emphasized by the phrase most weight. While ease, cost, staff interest, and skills are practical considerations, the paramount concern in healthcare quality improvement must always be patient safety and the effectiveness of clinical care. Prioritizing projects that directly reduce harm or improve health outcomes ensures that resources are directed towards what matters most to patients. For instance, a project reducing hospital-acquired infections, HAIs, would typically take precedence over one merely streamlining a non-clinical process, even if the latter is easier. Always remember that patient well-being is the ultimate driver in healthcare quality. Question 5. A hospital wants to reduce the average length of stay for patients undergoing hip replacement surgery. The quality team has collected data for the past year and wants to visually display variations in the length of stay over time to identify any trends or shifts. Which statistical tool would be most appropriate for this purpose? A. Pareto chart. B. Scatter plot. C. Control chart. D. Fishbone diagram. Answer C. Control chart. This question tests your understanding of appropriate statistical tools for analyzing process variation over time, with visually display variations over time to identify any trends or shifts as the key clue. A control chart is specifically designed to distinguish between common cause variation, random, expected variation within a stable process, and special cause variation, unpredictable, assignable variation due to specific events, in a process over time. For example, plotting the average length of stay for hip replacements on a control chart could reveal if the process is stable or if a specific intervention led to a sustained change. Think of control charts as your go-to tool for monitoring process stability and identifying genuine improvements or deteriorations. Question 6. A healthcare organization is developing a new policy for managing patient complaints. To ensure the policy is comprehensive and effective, the quality team decides to use failure mode and effects analysis, FMEA. What is the primary purpose of applying FMEA in this context? A. To identify the root causes of existing patient complaints. B. To proactively identify potential points of failure in the complaint process and mitigate their impact. C. To measure patient satisfaction with the new complaint management policy. D. To compare the new policy against national best practices for complaint resolution. Answer B. To proactively identify potential points of failure in the complaint process and mitigate their impact. This question explores the application of failure mode and effects analysis, FMEA, with primary purpose being the crucial keyword. FMEA is a prospective risk assessment tool used to identify potential failures before they occur in a new or redesigned process, evaluating their severity, occurrence, and detectability to implement preventive actions. For example, in a new complaint process, FMEA might identify that a lack of clear documentation steps could lead to lost complaints, prompting the team to add specific checkpoints. Unlike root cause analysis, RCA, which is reactive, FMEA helps you prevent problems by thinking ahead. Question 7. A critical component of a robust patient safety culture is the concept of a just culture. Which of the following best characterizes a just culture? A. A system where all errors are reported, and individuals are disciplined for any mistake, regardless of intent. B. An environment that holds individuals accountable for reckless behavior while recognizing that system failures often contribute to human error. C. A culture where errors are viewed solely as learning opportunities, and no individual is ever held responsible for adverse events. D. A reporting system focused on identifying blame to prevent future occurrences of similar errors. Answer B. An environment that holds individuals accountable for reckless behavior while recognizing that system failures often contribute to human error. This question directly tests your understanding of a just culture, a vital concept in patient safety, by asking for its best characterization. A just culture strikes a balance. It promotes a safe environment where staff feel comfortable reporting errors without fear of unjust blame, while still holding individuals accountable for intentional unsafe acts or reckless behavior. For instance, if a nurse makes an error due to an unclear medication label, system issue, it's treated differently than if they intentionally bypass a safety protocol. This approach encourages reporting by focusing on system improvements rather than solely punishing human error. Question 8. In a healthcare quality improvement project, what is the primary reason for developing an operational definition for a key measure? A. To ensure all staff members agree on the financial impact of the measure. B. To clearly and unambiguously define the measure so it can be consistently collected and interpreted. C. To determine the statistical significance of the data collected for the measure. D. To identify the root causes contributing to the performance of the measure. Answer B. To clearly and unambiguously define the measure so it can be consistently collected and interpreted. This question focuses on the importance of operational definitions in data collection for quality improvement, with primary reason being the key clue. An operational definition precisely specifies how a measure is to be collected, what is included, what is excluded, and how it will be interpreted, ensuring consistency and reliability across different data collectors and time points. For example, if measuring patient wait time, an operational definition would clarify whether it starts at arrival or check-in and ends at rooming or physician contact. Without this clarity, data can be inconsistent and unreliable, making accurate improvement difficult. Question 9. A quality manager is tasked with facilitating a team to reduce surgical site infections, SSIs. The team includes surgeons, nurses, infection control specialists, and administrators. Which leadership style would be most effective for the quality manager to employ to foster collaboration and empower the diverse team members? A. Autocratic, making all decisions to ensure quick implementation. B. Laissez-faire, allowing the team to self-organize without direction. C. Democratic or participative, involving team members in decision-making and problem-solving. D. Transactional, focusing solely on rewarding desired outcomes. Answer C. Democratic or participative, involving team members in decision-making and problem-solving. This question delves into effective leadership styles in quality improvement, specifically when leading a diverse team, highlighted by the words, most effective to foster collaboration and empower. A democratic or participative leadership style actively involves team members in discussions, decisions, and problem-solving, leveraging their diverse expertise and fostering a sense of ownership. For instance, allowing surgeons to contribute their perspective on operative techniques and nurses on post-operative care in developing SSI protocols leads to more practical and accepted solutions. This approach empowers the team, leading to more sustainable and creative solutions. Question 10. A hospital is planning to implement a new patient satisfaction survey. To ensure the survey accurately reflects the patient experience, the quality team should prioritize which aspect of the survey design? A. Making the survey as long as possible to gather extensive data. B. Using highly technical medical jargon to ensure precision. C. Ensuring the survey questions are clear, unbiased, and measure what they intend to measure. D. Distributing the survey only to patients who express positive feedback. Answer: C. Ensuring the survey questions are clear, unbiased, and measure what they intend to measure. This question addresses the fundamental principles of survey design in healthcare quality, specifically focusing on how to ensure accuracy in reflecting patient experience. The key is to create questions that are clear, unambiguous, and free from bias, so that patient responses genuinely reflect their experiences and perceptions. For example, asking "Were you satisfied with the exceptional care provided by our wonderful staff?" is biased, whereas "Please rate your satisfaction with staff communication on a scale of 1 to 5" is clear and neutral. Validity and reliability in survey questions are paramount to obtaining actionable and accurate data. Question 11. What is the primary purpose of a never event list in healthcare? A. To identify events that are financially uninsurable by healthcare organizations. B. To categorize medical errors based on their severity for internal reporting. C. To highlight serious, largely preventable adverse events that should never occur. D. To serve as a comprehensive list of all reportable patient safety incidents. Answer: C. To highlight serious, largely preventable adverse events that should never occur. This question specifically asks about the primary purpose of never events, a crucial concept in patient safety. Never events are egregious, unambiguous, and largely preventable medical errors that cause serious harm or death to a patient and are a clear indication of a serious safety problem within a healthcare organization. For instance, leaving a foreign object in a patient after surgery is a never event, emphasizing the need for robust system-level prevention strategies. The list aims to focus attention and resources on eliminating these specific, high-impact safety failures. Question 12. A quality improvement team has identified a high rate of patient readmissions for heart failure. They decide to create a visual representation that illustrates the relative frequency of different causes of readmission, ordered from most to least frequent. Which quality tool would be most appropriate for this purpose? A. Run chart. B. Pareto chart. C. Histogram. D. Scatter diagram. Answer: B. Pareto chart. This question tests your knowledge of quality improvement tools, specifically for identifying the vital few causes of a problem, indicated by illustrates the relative frequency of different causes, ordered from most to least frequent. A Pareto chart is a specialized bar chart that displays the frequency of causes in descending order, along with a cumulative percentage line, making it easy to see which causes are contributing the most to the problem, the 80-20 rule. For example, it might show that poor discharge planning accounts for 60% of heart failure readmissions, highlighting where to focus improvement efforts. It's excellent for prioritizing problem areas. Question 13. A healthcare system is implementing a new standardized protocol for sepsis management across all its hospitals. To ensure the successful adoption and sustainability of this change, what is the most crucial factor for the quality team to address? A. Providing financial incentives to staff for adherence to the protocol. B. Mandating compliance through strict disciplinary action for non-adherence. C. Engaging frontline staff in the design and implementation phases and addressing their concerns. D. Relying solely on training sessions to educate staff on the new protocol. Answer: C. engaging frontline staff in the design and implementation phases and addressing their concerns. This question focuses on effective change management in healthcare quality, specifically highlighting the most crucial factor for successful adoption and sustainability. Engaging frontline staff in the planning and implementation of changes, like a new sepsis protocol, is paramount because it fosters ownership, addresses practical concerns, and reduces resistance. For example, involving nurses in deciding how the new protocol fits into their workflow ensures it's clinically feasible and adopted willingly. Without their buy-in, even the best protocol can fail, so their active participation is key. Question 14. An organization is conducting a risk assessment for a new surgical procedure. Which of the following best describes the initial step in this risk assessment process? A. Developing a comprehensive mitigation plan for identified risks. B. Estimating the likelihood and potential impact of identified risks. C. Identifying potential hazards and adverse events associated with the procedure. D. Assigning responsibility for managing each identified risk. Answer: C. Identifying potential hazards and adverse events associated with the procedure. This question targets the initial step in a risk assessment process, and initial step is the crucial clue. Before any other action, the fundamental first step in any risk assessment is to identify what could potentially go wrong, the hazards, risks, or adverse events inherent in the process or procedure. For example, before evaluating the likelihood of a complication in a new surgery, you must first list all possible complications. Without thoroughly identifying the risks, you cannot effectively analyze, mitigate, or manage them. Question 15. A CPHQ is reviewing a report on patient satisfaction scores. The report shows a significant drop in scores over the last quarter. Before developing an action plan, what should the CPHQ first verify about the data? A. Whether the data collection method was changed during the quarter. B. The national average for patient satisfaction scores. C. The individual names of patients who provided negative feedback. D. The specific departments responsible for the decline. Answer: A. Whether the data collection method was changed during the quarter. This question assesses a critical thinking skill for a CPHQ when interpreting data, specifically highlighted by first verify about the data before acting on a significant drop. Any change in data collection methodology, such as a new survey tool or different administration process, can artificially create a perceived drop or rise in scores, making comparisons invalid. For example, if the survey switched from paper to an online format that older patients struggled with, the drop might reflect access issues rather than true dissatisfaction. Always check the integrity and consistency of your data collection process before drawing conclusions or planning interventions. Question 16. In the context of healthcare quality, what is the primary benefit of using evidence-based practice, EBP, guidelines? A. To reduce healthcare costs by limiting unnecessary interventions. B. To standardize clinical care based on the best available research and expert consensus. C. To eliminate the need for clinical judgment in complex patient cases. D. To simplify documentation requirements for healthcare providers. Answer: B. To standardize clinical care based on the best available research and expert consensus. This question asks for the primary benefit of evidence-based practice, EBP, guidelines, a cornerstone of modern healthcare quality, with primary benefit as the key. EBP integrates the best available research evidence with clinical expertise and patient values to guide clinical decision-making, ensuring that care is consistent, effective, and rooted in proven methods. For example, An EBP guideline for ventilator-associated pneumonia, VAP, prevention ensures all patients receive care based on strategies demonstrated to be most effective. This standardization leads to better, more predictable patient outcomes by reducing unwarranted variation in care. Question 17. A quality team is using the PDSA, Plan Do Study Act, cycle to improve the patient discharge process. After implementing a new discharge checklist, what is the most important activity during the study phase? A. Analyzing the data collected to determine if the change resulted in the desired improvement. B. Planning the next cycle of improvement with new interventions. C. Standardizing the new discharge checklist across all units. D. Obtaining buy-in from all stakeholders for the new process. Answer. A. Analyzing the data collected to determine if the change resulted in the desired improvement. This question focuses on the specific activities within the study phase of the PDSA cycle, with most important activity being the key. In the study phase, the primary goal is to evaluate the results of the do phase by analyzing the data collected to understand if the change actually led to the expected improvement or if further adjustments are needed. For example, after implementing a new discharge checklist, you would analyze readmission rates, patient satisfaction, or staff compliance data to see if the checklist had its intended effect. This critical analysis helps you learn from the test and make informed decisions for the next steps. Question 18. An organization is conducting a patient safety investigation following a serious adverse event. Which of the following principles should guide the investigation to promote a culture of learning rather than blame? A. Focus on identifying the individual who made the mistake and implementing disciplinary action. B. Assume human error is inevitable and focus solely on system-level vulnerabilities. C. Investigate with a just culture perspective, balancing accountability with system analysis. D. Limit the investigation to only immediate causes to prevent overwhelming the team. Answer. C. Investigate with a just culture perspective, balancing accountability with system analysis. This question highlights the crucial guiding principle for patient safety investigations, emphasizing the need to promote a culture of learning rather than blame. A just culture approach is vital here. It involves thoroughly analyzing system failures and design flaws that contribute to errors, while also holding individuals accountable for truly reckless or intentionally unsafe acts. For example, an investigation might uncover that an error was due to an unclear medication label, system issue, rather than a careless nurse, leading to a system change. This balance encourages reporting and learning, ultimately strengthening safety defenses. Question 19. A hospital aims to improve its hand hygiene compliance rate among clinical staff. They decide to observe staff behavior directly and record instances of compliance and non-compliance. What type of data is being collected in this scenario? A. Self-reported data. B. Administrative data. C. Observational data. D. Financial data. Answer. C. Observational data. This question asks to identify the type of data being collected when staff behavior is directly watched and recorded, with observe staff behavior directly and record instances as the key clue. Observational data is gathered by directly witnessing and documenting events or behaviors as they occur in a real-world setting, without relying on self-reporting or existing records. For example, a quality improvement team member standing in a hallway and noting hand hygiene compliance is collecting observational data. This method provides first-hand, real-time insights into processes and behaviors. Question 20. Which statistical measure is most appropriate for describing the central tendency of categorical data, such as patient gender or blood type? A. Mean. B. Median. C. Mode. D. Standard deviation. Answer: C. Mode. This question targets the appropriate measure of central tendency for categorical data, with patient gender or blood type as examples of such data. For categorical data, where values are labels rather than numbers that can be averaged, the mode is the only suitable measure of central tendency. The mode represents the most frequently occurring category or value in a dataset. For example, if a patient population consists of 60% females and 40% males, female would be the mode for gender, as it's the most common category. Remember, the mean and median are for numerical data. Question 21. A healthcare organization is required to submit quality data to external regulatory bodies. Which of the following is the most important consideration for the quality department when preparing these submissions? A. Including only data that shows positive organizational performance. B. Ensuring data accuracy, completeness, and adherence to specified reporting standards. C. Providing extensive qualitative descriptions of patient experiences. D. Submitting data only when the organization has achieved top quartile performance. Answer: B. Ensuring data accuracy, completeness, and adherence to specified reporting standards. This question emphasizes the most important consideration when reporting quality data to external regulatory bodies, with most important consideration and external regulatory bodies as key phrases. The paramount concern for such submissions is the absolute integrity of the data. It must be accurate, complete, and strictly follow the precise formatting and definitions mandated by the regulatory body. For example, submitting incorrect or incomplete data for readmission rates could lead to penalties or misrepresentation of organizational performance. Regulatory bodies rely on this data for public reporting and accountability, so its fidelity is non-negotiable. Question 22. The Triple Aim framework in healthcare quality seeks to achieve simultaneous improvements in three critical dimensions. Which of the following accurately represents these three aims? A. Increased revenue, reduced staff turnover, and improved technology adoption. B. Improving the patient experience of care, improving the health of populations, and reducing the per capita cost of healthcare. C. Enhancing physician autonomy, expanding facility infrastructure, and minimizing legal risks. D. Maximizing market share, optimizing public relations, and achieving financial stability. Answer: B. Improving the patient experience of care, improving the health of populations, and reducing the per capita cost of healthcare. This question directly tests your knowledge of the fundamental Triple Aim framework, a widely recognized approach in healthcare quality improvement. The Triple Aim focuses on simultaneously pursuing three interconnected goals: enhancing the individual patient's experience of care, including quality and satisfaction, improving the overall health of populations, and reducing the per capita cost of healthcare. For example, a project that improves chronic disease management might enhance patient experience, improve population health outcomes, and reduce expensive emergency department visits. Understanding these three interdependent goals is central to strategic quality initiatives. Question 23. A quality improvement project team has developed several potential solutions to a problem. Before full implementation, they want to choose the most feasible and impactful solution. Which decision-making tool would be most helpful for systematically evaluating and prioritizing these options? A. Brainstorming. B. Affinity diagram. C. Prioritization matrix, for example, impact/effort matrix. D. Force field analysis. Answer: C. Prioritization matrix, for example, impact/effort matrix. This question asks for the most helpful tool to systematically evaluate and prioritize multiple solutions, specifically looking for the most feasible and impactful option. A prioritization matrix, such as an impact/effort matrix, is an excellent tool for this purpose, as it allows a team to objectively score each potential solution based on criteria like potential impact on the problem and the effort/resources required for implementation. For example, a matrix might reveal that solution A has high impact and low effort, making it a clear winner over solution B, which has low impact and high effort. It helps teams make data-informed decisions for moving forward. Question 24. A hospital's quality department is tasked with monitoring the effectiveness of a new sepsis alert system. They want to determine if the new system has led to a statistically significant decrease in the time from sepsis identification to antibiotic administration. Which type of statistical analysis would be most appropriate? A. Descriptive statistics, for example, mean, median. B. Inferential statistics, for example, t-test, ANOVA. C. Correlation analysis. D. Regression analysis. Answer B. Inferential statistics, for example, t-test, ANOVA. This question focuses on the appropriate statistical analysis for determining a statistically significant decrease between two groups or over time, following an intervention. Inferential statistics, such as a t-test, for comparing two means, or ANOVA, for comparing more than two means, are specifically used to make inferences about a population based on sample data and to determine if observed differences are likely due to the intervention or merely chance. For instance, a t-test could compare the mean time to antibiotic administration before and after the new alert system, indicating if the difference is statistically significant. Descriptive statistics only summarize data, while inferential statistics allow you to draw conclusions about cause and effect or significant differences. Question 25. What is the primary role of a hospital's credentialing and privileging process in ensuring healthcare quality? A. To manage the hospital's financial reimbursement from insurance companies. B. To ensure that all healthcare professionals working in the hospital meet specific standards of education, training, and competency for the services they provide. C. To monitor the daily performance of all employed staff members. D. To resolve patient complaints and grievances against staff. Answer B. To ensure that all healthcare professionals working in the hospital meet specific standards of education, training, and competency for the services they provide. This question targets the primary role of credentialing and privileging, a foundational process in healthcare quality and patient safety. Credentialing is the process of verifying a practitioner's qualifications, education, licensure, experience, while privileging is granting specific clinical procedures and treatments based on competence. For example, a surgeon must be credentialed with a valid medical license and then privileged to perform specific types of surgeries based on their verified training and experience. This rigorous vetting process is essential to assure patients that their care providers are qualified and competent, directly impacting patient safety and care quality.